Hello friends, today we are going to discuss Telemedicine Triage, also called as Tele-triage. I am Dr. Suresh Bharatmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit at NIMANS, Bangalore. This presentation is based on Telemedicine Practice Guideline released on 25th March 2020 by the Ministry of Health and Family Welfare, Board of Governors, in partnership with Niti Aayog. Although this guideline is part of Appendix 5 of Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation 2002, it is also a legally valid document under National Medical Commission Act of 2019. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only, not for legal opinion. If you want to have a legal opinion, please do contact an advocate. Conflict of interest? None. At the same time, we also request you kindly to refer the original document of Telemedicine Practice Guideline and also visit the National Medical Commission website for any updates or amendments on this guideline. Let's move on to understand about Tele-triage. Before we go further, let's understand what triage means. Triage is a process of quickly examining the patient in order to decide which one are those patients who are serious and must be dealt on priority basis. And these are the situation which we see in emergency cases or else in disaster situation. Then what is Tele-triage? Basically, Tele-triage is a process of using technology to categorize the severity of the patient and prioritize the services which the patient requires. So let's understand very important point. The Telemedicine Practice Guideline is very clear about emergency situation. It clearly mandates in all cases of emergency, the patient must be referred for in-person consultation with the RMP. So please do remember this. Now let's understand different types of consultation. So there are 4 different types of consultations. First and the foremost, patient initiating the consultation with the doctor. Second one is healthcare worker initiating the consultation with the RMP. The third one is doctor initiating the consultation for an opinion with the specialist or another doctor. Last one is caregiver initiating the consultation with the doctor. So these are the 4 types of triage or else consultation which has been mentioned in the Telemedicine Practice Guideline. Now take the first one, that is patient initiating the consultation with the doctor. Again, when the patient initiates the consultation with the doctor, there are 2 types again. First consultation and follow-up consultation. Now, we will discuss about first consultation. As per Telemedicine Practice Guideline, first consult means the patient is consulting the doctor for the first time, or else he had consulted the doctor more than 6 months back, or else he has consulted recently, but however, for a different health condition. For example, if the patient had consulted the doctor for epilepsy 1 month back, now he is consulting for fever. So these are 2 different health conditions. Now it is considered as first consult, not a tele-follow-up consult. Moving further, let's understand the process of first consult. This is how the process of first consult starts. Patient initiates the telemedicine consultation by contacting the doctor either by a email or SMS or else even a phone call or a video call. As soon as the patient initiates the consultation, it is considered as implied consent. So once it is done, the doctor will identify the patient and then the doctor will do a quick assessment whether there is an emergency consultation is required or emergency care is required. If the emergency care is required, the doctor will give first aid advice, counseling, and in-person consultation referral. And also, he will facilitate the referral. If there is no emergency is required, he will do a detailed assessment, collect more information, and also he will do investigation. During this process, if he feels the investigation is required, he will pause the consultation and he will give a new appointment. But however, during this process, he comes to know the patient requires an emergency care, immediately he will refer for in-person consultation. If the patient requires investigation, the doctor will give the prescription for list of investigation. If the patient requires general physical examination, he will refer him to the nearest RMP for in-person consultation and general physical examination. He will document that, give the prescription, and also the next appointment is fixed. However, please do remember the next consultation is not a follow-up consultation. It is again a first consult. Once the patient brings all the investigation, general physical examination report, the first consultation continues. During that process, once the doctor is able to arrive for a diagnosis or a provisional diagnosis, he will do health education, counseling, and medication list O is prescribed. List O is nothing but over-the-counter medication. If the first consultation is a video consultation, the doctor is authorized to write list A medication. List A medications are those medications which has least abusive potentials. Now we will move to the second types of consultation, that is follow-up consult. That is again patient-initiated consultation with the doctor. What is follow-up consult as per the Telemedicine Practice Guideline? Telemedicine Practice Guideline is very clear. The patient should have contacted the doctor in person in the past 6 months. It is very essential. That means two criteria has been kept. In-person consultation within past 6 months has to be done. And it excludes if the patient had contacted the doctor for in-person consultation for a different health condition, that is not considered as a tele-follow-up. Now, even the doctor does not remember the patient for in-person consultation, then also it is excluded. Then it is considered as first consult. So please do remember, tele-follow-up means two important criteria. In-person consultation in past 6 months. So that is very essential. Any number of time, teleconsultation will be first consult only. Mandatory requirement of in-person consultation in the past 6 months to consider it as a tele-follow-up. Moving further, let's take step by step the process of tele-follow-up consult. Again, the patient had contacted the doctor earlier in a face-to-face consultation or in-person consultation. Now the patient has initiated the telemedicine consultation through either the text, audio, or video. Text is basically SMS or email. Audio is by a phone call or a video call. As soon as it is done, it will be considered as implied consent. Now the doctor will identify the patient. Identification process we will discuss shortly. Once the identification is done, the doctor will do a quick assessment of whether there is emergency care is required. If the emergency care is required, doctor will advise for first aid, and he will also do some counseling and facilitate for in-person consultation. If there is no emergency is required, the doctor will ask for more information if required, investigation if required, and by chance, if there is an emergency care is required, again he will refer them, or else he will look for investigations, and also he will ask for general physical examination if required, and also he may ask for if there is an emergency in-person consultation. He will document the advice, close the session, and he will give one more appointment. If it is not so, and if he is able to arrive for a provisional diagnosis, he will do the following things. One is health education and counseling. Since this is a tele-follow-up, he is allowed for refilling whatever medication has been given in the in-person consultation. They are all called as medication list B. However, in this process, if the doctor comes to know there is a new complaint and a new health condition, then it will be considered as the first consult. So what is the method of identification, which I spoke about recently? It is identification of a patient. See, Telemedicine Practice Guideline is very clear. It clearly says there is no way anonymous consultation is allowed, either from the patient side or from the doctor side. Both the parties need to identify each other. So what is the process? The Telemedicine Practice Guideline casts an obligation on the doctor to identify the patient. So the doctor has to request for photo ID card, which is generated by the government. It can be anything. For example, it can be Aadhaar card, it can be a PAN card, anything which has a photo ID. You will look for the age, address, name, family member's name, and any other registered ID. If it is a follow-up, old registered ID will ask for, and a phone number. Once the doctor is satisfied with the identification, now the doctor has to introduce himself to the patient. He will identify himself with the name, registration number, especially medical council, specialty, and degree. Once the identification is done on both the side, the consultation proceeds. Without that, it is not allowed. Let's look into the tele-triage, the second scenario, where healthcare worker is initiating the consultation on behalf of the patient with the RMP. So what should we do? Here the healthcare worker has initiated the consultation with the RMP on behalf of patient. Who is healthcare worker? As telemedicine practice guideline, healthcare worker means a nurse, allied health professional, mid-level health practitioner, ANM, or any other health worker designated by the appropriate state authority or any other authority. So, in this scenario, healthcare worker will initiate the telemedicine consultation with the doctor on behalf of the patient. So, what are the settings? The healthcare worker can initiate this consultation from the health camps, from the rural area, home visits. The healthcare worker has gone to home visit. From there, he is initiating the telemedicine consultation. From the ambulance, basically medical mobile units, what we call it as, or in any community-based settings. So these are the situation where the healthcare worker can initiate the telemedicine consultation on behalf of the patient with the doctor. But however, although it is on behalf of the patient, there are some responsibility has been casted under the telemedicine practice guideline for the healthcare workers. Healthcare workers should verify the ID, should also introduce himself or herself to the patient, take explicit consent, very essential. That means he has to say that I am initiating the telemedicine consultation. Is it okay for you? So that I can discuss with the doctor, and also you can also discuss with the doctor. That explicit consent has to be there, and it should be a written consent. And also, the healthcare worker should have examined the patient in person. Also, he should explain the limitations and benefit of telemedicine consultation. These are the responsibility casted on healthcare worker before he initiates the telemedicine consultation with the doctor. Once the telemedicine consultation is initiated, now the RMP has to do certain things, such as verify the ID, he has to introduce himself to the patient, check for the explicit consent. Again, that's very essential. Get the patient information from the healthcare worker. If he requires more information, he may clarify. He may ask the healthcare worker to do certain general physical examination, and he may ask for investigation also. Further, the RMP, if he is satisfied with the information, he may arrive with a provisional diagnosis or a diagnosis. And then he can give health education, counseling, and prescribing medication depending upon the type of consult. If it is a first consult, you will be allowed for list O, and it is a video consultation, list A medication is allowed. If it is a tele-follow-up, list B is allowed along with O and A. Please do remember, in such a scenario, injections can be prescribed by the doctor, but that prescription has to go to the healthcare worker so that the healthcare worker can give the injection to the patient. Documentation of the whole process is very essential. And what is the role of healthcare workers once the consultation is over? Once the consultation is over, the healthcare worker has to emphasize on the first aid, should do counseling, also if required facilitate referral in case of emergency is there, health education, and also counseling. More emphasis has to be done. Lifestyle modification emphasis can be done. Providing medicines or distributing medicine or administering the injection has to be done. Follow-up appointment can be given. Now, let's move into the third scenario. Is RMP or the doctor initiating the telemedicine consultation on behalf of the patient with the other doctor or a specialist. It is basically for an opinion. Now, let's move into this. So, how to do telemedicine consultation between a RMP and a specialist? Again, a doctor can consult with another doctor or else with a specialist for an opinion and for treatment. Here again, if the patient is involved during the consultation, the explicit consent has to be taken. If the patient is not involved and if the consultation is anonymous, no need of explicit consent. But if the patient identification is revealed or else if the patient is involved, please do take explicit consent. And also, here the Telemedicine Practice Guideline has an obligation on the treating doctor. It clearly says the treating doctor will be responsible for the opinion, will be responsible for implementing the advice given by the specialist. So this has been casted upon the treating physician or treating doctor. Now we will move into the last part, caregiver initiating the consultation with the doctor directly. Now, how to do this telemedicine consultation between a patient and a RMP through a caregiver. Let's understand what is a caregiver. Caregiver could be a family member or any person authorized by the patient to represent him. So let's move and understand what are the different scenarios. The caregiver has initiated the consultation. There are two possibilities. One, patient is present with the caregiver. Second, the patient is absent. Now move to the first one. Caregiver and the patient both are present, but however, the patient is a minor, is less than 16 years. In such a scenario, go ahead with the consultation because the caregiver will be considered as a legal guardian and his consent is more than enough. If the patient is adult, please do ask for a consent. Say that request whether does not have any reservation discussing his problem in front of the caregiver. If the patient says yes, go ahead with the consultation. If the patient places a reservation, request the caregiver to leave the consultation and continue the consultation with the patient alone. If the patient denies of continuing the consultation, stop the consultation. So this is how the caregiver initiated consultation along with the patient occurs. Suppose the caregiver has initiated the consultation, there is no patient at all. Patient is absent. In such a scenario, please look for authorization letter. Check for the photo ID of the caregiver. Relationship proof between the patient and the caregiver, and it should be a follow-up consult. First consult is generally not advisable for such a scenario. But this is a very tricky situation where the caregiver has initiated the consultation, but there is no patient. So in such a scenario, please exercise caution. Request for authorization letter, check for the photo ID, ensure the relationship between the patient and the caregiver. If required, contact the patient through the mobile phone, which the phone number which was been given during the registration. If in doubt, stop the consultation. Request them for in-person consultation. To conclude, dear friends, Tele-triage is very beneficial, especially in case of bedridden, senior citizen, geriatric cases, neurological cases, or where the patient cannot be transported. Please use Tele-triage. Please do use this with your professional discretion. In emergency care, it should be in-person consult as per Telemedicine Practice Guideline. And in absentia, tele-follow-up is allowed, but however, exercise caution, ask for authorization letter, ask for ID, verify the relationship. Thanks for giving your valuable time. Stay safe.